Hello, everyone, and thank you for joining me today. My name is Karen Enriquez, and I am the SEGO Area Agency on Aging Family Caregiver Support Program Care Coordinator for Cochise, Graham, Greenlee, and Santa Cruz counties. Today I'm presenting Caregiver Challenges, Cognitive Impairment. Many American families care for an adult with a cognitive impairment. Cognitively impaired people have difficulty with one or more of the basic functions of their brain, such as perception, memory, concentration, and reasoning skills. Each situation has its own unique features, and caregivers often share common problems, situations, and strategies for coping. Caring for an older family member with a physical or cognitive impairment is a difficult and strenuous process. Caregivers often struggle to balance their own needs with those of the care recipient. Their relationships with family, friends, coworkers, and even the care recipient, their loved one, can suffer as well. This webinar will address the challenges of cognitive impairment and its impact on caregiving. Have you ever been worried about a loved one's memory or thinking abilities? Maybe your parent has seemed more confused recently, or you may have noticed that your aging spouse is repeating herself or struggling to do things that were routine in the past. These are very common concerns, and they often lead to questions such as, is this normal aging or something more significant? What is wrong? Could this be Alzheimer's or some other form of dementia? Can this be treated or reversed? What do we do? The answer to the last question is this: if you're worried about memory or thinking, then definitely follow up with a medical evaluation. That's because when families worry about an older person's cognitive abilities, there is often some underlying health issue that's affecting the mind's function. Technically, these kinds of problems are called cognitive impairment. It's a very broad term that means some kind of problem or difficulty with one's memory, thinking, concentration, and other functions of the conscious brain. The difficulties are beyond what might be considered normal cognitive aging. It's important not to ignore changes in an older person's memory or personality, or assume it's just a part of aging. We know that cognitive impairment can change how a person thinks or acts or even feels. These changes often present special challenges for families and caregivers. An ordinary conversation, for example, can be very frustrating when your loved one has difficulty remembering from one moment to the next. Cognitive impairment impacts remembering, learning new things, concentrating, or making decisions that affect their everyday life, and ranges from mild to severe. Mild cognitive impairment is a syndrome recognized as cognitive decline greater than what's expected for an individual's age and educational level. It also interferes with functioning performance, but without other symptoms that could warrant a diagnosis of Alzheimer's disease. It's kind of the transitional phase between healthy cognitive aging and dementia. People with mild cognitive impairment have more memory problems than normal for their age, but their symptoms do not interfere with their everyday lives. Although the risk is greater for developing Alzheimer's, not all of them will. Some may even go back to normal cognition. Most family caregiver studies have focused on family caregivers of persons with Alzheimer's disease, but very few studies have discussed family caregivers and the mild cognitive impairment. Short-term memory decline is one of the first and the earliest signs of mild cognitive impairment. This memory decline is characterized by difficulty in engaging in familiar tasks, behavioral changes, emotional changes, and changes in social activity engagement. Cognitive impairment, which is also called cognitive decline, can come on suddenly or gradually and can be temporary or more permanent. It may or may not keep getting slowly worse. It all depends on the underlying cause or causes. Individuals with moderate to severe dementia or other cognitive impairment often require special care, including supervision, sometimes 24 hours a day, specialized communication techniques, and management of difficult behaviors. They may require help with activities of daily living, such as bathing, eating, transferring from bed to a chair or to a wheelchair, toileting, and other personal care. Not all cognitive problems are caused by Alzheimer's disease. There are a variety of other causes. Cognitive impairment, like many other problems in older adults, is often due to more than one cause. Common causes of impairment in older adults that affect the brain ability can be medication side effects. Many tranquilizers and sedatives interfere with proper brain function. Metabolic imbalances. This term refers to abnormalities in one's blood chemistry, like abnormal levels of blood sodium, calcium, or glucose. Kidney or liver dysfunction can also cause certain types of metabolic imbalances, and these sometimes affect brain function. Problems with hormones, such as thyroid hormones, imbalances in estrogen, may also affect cognitive function. Deficiencies in vitamins and other key nutrients. Brain function is especially known to be affected by low levels of vitamin B12 and other B vitamins and folate. There's also delirium. This is a state of worse than usual mental function that can be brought on by just about any type of serious illness. Delirium is very common in hospitalized older adults and can also occur due to infection or other health problems in older people who are not hospitalized. Psychiatric illness. Most psychiatric conditions can cause problems with memory, thinking, or concentration. Psychiatric illness can also cause paranoia and other forms of late-life psychosis. Depression and anxiety are probably the most common psychiatric condition in older adults. It is also possible for them to have bipolar disorders, schizophrenia, or other forms of major mental illnesses, but mostly those have already been diagnosed earlier in life. Substance abuse and/or substance withdrawal. Both acute intoxication and chronic overuse of certain substances such as alcohol, drugs, illicit or prescription drugs can impair brain function. Damage to brain neurons due to an injury. Vascular damage to neurons means damage caused by problems with blood vessels, such as a stroke or some form of cerebral small vessel disease. Head injuries are also associated with temporary or longer-lasting cognitive impairment. Infections. This is not as common in older adults as the other causes, but certainly chronic or acute infections can affect brain cells directly. If cognitive impairment is caused by an infection outside of the brain, such as pneumonia or a urinary tract infection, they would be considered a delirium. Toxins are another potential cause of cognitive impairment. Research is ongoing as to the cognitive effects of toxins people may be exposed to, such as heavy metals, air pollutants, and contaminants in our drinking water, pesticides, and other sources. Damage to brain neurons due to a neurodegenerative condition tend to slowly damage and kill neurons. This can cause mild cognitive impairment and then eventually dementia. The most common conditions include Alzheimer's disease, Lewy body disease, Parkinson's disease, and frontotemporal degeneration. All family caregivers face challenges, but these challenges are compounded for people caring for patients with Alzheimer's disease and other dementias. Individuals with cognitive impairment may experience a range of behavioral problems that can be frustrating to caregivers. Some people may develop behavioral problems early on, while others go their entire illness with only minor issues. Most cognitive impaired people fall somewhere in the middle, having good days and bad days, or even just bad moments. Caregivers may realize that their person is having difficulty engaging in previously familiar tasks such as putting household items away, changing light bulbs, or preparing dinner. As caregivers realize they're having difficulty in performing activities as usual, they gradually begin taking over those tasks and responsibilities. Emotional changes commonly found by caregivers included their person, and from now on we'll use the term spouse, getting easily upset or angry, feeling irritable, worried, or sad as a consequence of having difficulty in remembering or doing what used to be a familiar task. Caregivers also realized that their spouse had difficulty in understanding the context or had difficulty in following conversations while talking in groups of people, which caused them to withdraw from social interaction. As caregivers work through the realization that their loved one has gradually declined in cognitive and functional ability, they gradually take over more of the obligations in order to help them to be able to remain engaged in everyday activities. Caregivers gradually begin to take charge as part of their long journey of caregiving. They identified their major needs and concerns and find care strategies that work best for them and their spouses. Older adults with cognitive impairment are often unaware of or reluctant to reveal the difficulties they're experiencing. Stepping in to make multiple decisions for the patient is challenging for caregivers, especially those financial and legal decisions. Some decision-making requires new knowledge and skills or professional assistance, such as if you were selling property, your house, or relocating to a retirement housing, even filing taxes or making decisions on treatment. Caregivers first realize the change in their spouse's behavior and performance capability, and then they follow with a reflection on the changes that have happened. The caregiver gradually recognizes that their quality of life has been significantly affected by their spouse's cognitive impairment, but at the same time, they gradually take on the roles and activities that were previously performed by their spouse as they experience an increased sense of obligation to take care of them. Even at the stage of mild impairment, caregivers experience a high cost to the quality of their life, including the quality of both married and personal lives, and they often feel lonely. Most caregivers report that their major needs and concerns is searching for current information regarding the meaning of neuropsychological tests results at the diagnosis of cognitive impairment, especially related to the prognosis. They also need current information on pharmacological and non-pharmacological treatments. They expect the information to be provided by their healthcare providers. The need to feel understood by the healthcare providers is very important to them. They also have financial concerns associated with their spouse's increasing inability to manage finances, the costly new medications that are being prescribed, and the need to adjust their work situations to assure their spouse's safety and care. This basic information not only provides a realistic view of the situation, but also lays the groundwork for making current and future decisions. Information is empowering and will increase confidence. They also have concerns and needs regarding establishing effective communication skills. Those concerns are centered on the need to minimize misunderstandings and to retain or regain a trusting relationship. Care recipients often feel like they are being treated like a child, and so there can be battles. Communication techniques such as keeping language simple and asking one question at a time are essential. And always remember to be patient when waiting for a response. Caregivers experience concerns about communicating using white lies because the conflict between inner values and reality, they really can't tell them everything or they have to cope with the results of it. It can cause emotional issues. Most caregivers also recognize their stress is associated with the patient's emotional distress and behaviors, such as repeating questions, misplacing items, withdrawing from significant social events, and many other situations. Wandering and poor judgment may signal the need for 24-hour supervision. Gradually and over time, caregivers develop new coping strategies in dealing with those stressors. Becoming aware of the spouse's mild memory problem is a lengthy and confusing process. Caregivers try to define and sort out their spouse's unusual behaviors, research the conclusion that their spouse's behaviors are not normal and are problematic. And then they try to figure out what to do next. The specific troublesome behaviors can be this asking a question over and over again, trouble remembering recent things, as well as getting angry easy and engaging in social activities less than normal. At this stage of cognitive impairment, caregivers may also gradually experience loss of intimacy in their relationship, loss of communication, and loss of the hoped-for future. This loss of social interactions and fun. They can experience a wide range of distressful emotions such as shock, anger, guilt, anxiety, frustration, sadness, loneliness, helplessness, and uncertainty associated with the symptoms of the cognitive impairment, behavioral changes, and functional deficits. Anticipating that there will be ups and downs, maintaining patience, compassion, and a sense of humor will help with coping more effectively with the difficult behaviors. It is important to remember it is the disease, not the person, causing the behavior. With mild cognitive impairment, much can be done to improve the patient's quality of life. Measures such as modifications in daily routine and medications may help control symptoms. Decline is rarely rapid. There is time to adapt to the possibility that eventually they may need more help at home or may have to look into residential care. At the early stages of cognitive decline, patients and their caregivers may have a critical window to develop important self-management skills that may prevent premature disability and disengagement. Developing self-management skills may improve the quality of life for both the mild cognitive impaired patient and their caregivers. Caregivers must cope with uncertainty in dealing with symptoms, diagnosis, prognosis, the relationship with each other and with others in the family, and the necessity of making future plans. During the early stages of cognitive impairment, your loved one is more aware of their decisions, and this is the perfect opportunity to make balanced and mutually agreed upon decisions based on their strengths, limitations at this stage. They might also discuss future scenarios, perhaps when driving is no longer safe. This could make it easier for the caregiver to have the resolve to tell the patient, "You have to stop driving" when the time comes. These skills included managing their loved one's emotional distress, which can be the hardest part, determining their needs. No one wants to make anyone feel like they are less of a person or embarrass someone. Assess their performance capacity, deal with safety issues. Caregivers learn through trial and error the best ways to help with maintaining or establishing routines for eating, hygiene, and all other activities at home. You may need training in the use of assistive equipment and behavior management. Learning strategies to assure that their spouse was not being cheated when handling money, or when they have to take away their debit card or even their car. Not knowing how they will react, you should also develop a list of financial assets and liabilities, as in checking or savings account, IRAs, etc. Most people prefer to keep their financial affairs private. In order to prepare and protect your loved one, you will need to gain a full understanding of his or her financial picture. Making long-term care plans, deciding when to bring in-home care or the move to an assisted care facility. Be sure to review all legal documents. This can be another delicate but necessary subject to discuss. Keep the spouse involved with usual life routine activities. They might not know what to do for the entire day and need someone to guide them. There's always the concern on how to keep them busy and productive. Understanding and dealing with the behaviors, repeated questions, sleeping problems, misplaced items. Being informed will help you to know what to expect as the disease progresses. Caregivers need information regarding the diagnosis and the treatment, providing brief information and early support. Oriented therapies for caregivers and patients at the earliest stages may later minimize emotional distress. Providing early intervention on caregiving knowledge and skill building may help caregivers' confidence and prevent or minimize the patient's problem behaviors, and will obtain better outcomes with less cost over time. Interventions help caregivers gain awareness, information, and learn skills to more effectively deal with and adjust to caring for their loved ones. Learning how to build a reminder system using to-do lists, calendars with large print, listing important contact phone numbers in visible places are some of the ways. Engage in some pleasurable activities together, going to church or eating out with a good friend after the coronavirus has calmed down. Give adequate time for the spouse to communicate. Sometimes having a pet as company helps. Move into a retirement condo to allow more time to focus on each other. and by controlling unwanted mail. There's so many ways of being mindful to manage their own emotional distress and health needs. If you care for a person with dementia, you face greater risks for healthcare problems than other caregivers. You are particularly at risk for caregiver burnout, a state of mental and physical exhaustion brought on by the physical, mental, emotional, and/or financial stresses of providing ongoing care, usually over long periods of time. Does that sound familiar? Take care of yourself. It is one of the most important part of being prepared and learning care strategies. Get regular respite, especially when the patient requires constant attention. Consider joining a support group for tips about coping daily, sharing your diagnosis, changes in relationships, tips and tricks. It really makes a difference. Do some legal, financial, and long-term care planning and look for information to help you plan. Prepare and update your own will. A living will, healthcare power of attorney, and financial power of attorney for the care recipient will be needed. Learn about care you may need in the future and possibly ways to pay for it. Get help as needed with day-to-day tasks. Contact relevant local healthcare and social service agencies for assistance. Stick with familiar places, people, and routines. Try to simplify your life. Use simple memory aids like a notebook or sticky notes to jot down reminders, a pillbox to keep medications organized, and a calendar to record appointments. Ask family members or friends, or find local services to help with routine tasks, such as cooking, paying bills, transportation, or shopping. Consider using technology solutions for medication management safety, or alarms, emergency response, those types of care. Be safe at home. Get home safety tips and do a home safety evaluation. Stay healthy and be active. Getting exercise helps everyone and keeps the muscles and joints and heart in good shape, even with Alzheimer's patients. Eat a well-balanced diet that includes fruits, vegetables, and whole grain products. They're finding that the Mediterranean type of diet is the best for cognitive and health. Continue to enjoy visits with family and friends, hobbies, and outings. Get regular medical care. Make regular appointments with your primary care doctor and specialists. Consider taking your care recipient to a specialized memory disorder clinic, or consider participating in clinical trials. Your doctor will have information, or local medical centers or universities. Inform yourself and know what you're up against. Dementia of all types typically gets progressively worse over time. The more you know, the more you will be able to learn from the time spent with your loved one. When you do interact with your person, pay close attention to the communication. Make eye contact. Maximize the use of nonverbal cues. Use names rather than pronouns. Allow more time for them to process the information. And listen actively. Let the person know if you don't understand something. Avoid humoring or condescension. You are not speaking to a child, no matter how tempting it may be to make that association. If you treat the conversation as normal as possible, you will maximize the results of the conversation, because your loved one almost certainly knows when you're talking to them differently. At the end of the day, caring for a loved one with a cognitive impairment will be difficult. Take comfort in knowing that there will be good days to go along with the bad, and just know that your loved one is still with you. They just need your patience. The number of services for cognitively impaired adults and caregivers is growing. Each time you reach out and speak with someone, ask for referrals of others that could possibly assist you. Find your local Alzheimer's organization, such as an association chapter at 1-800-272-3900. Find local member organizations and providers affiliated with the Alzheimer's Foundation of America at 1-866-232-8484. Your local hospitals may also have educational programs about Alzheimer's disease and dementia. And you can find local services by contacting Elder Care Locator. It's a 1-800 number 677-1116. The Seagull Area Agency on Aging is available to you. All you have to do is reach out and ask for help. We have an established caregiver support group, and this peer-led group can help to reduce the feeling that you're all alone. The group is meeting virtually via Zoom on Wednesday mornings at 10 o'clock. The meeting notification and the links to attend are posted on the Seagull Area Agency on Aging Facebook page each week, or you can contact me directly for the attendance link. Please be sure to look at the Seagull website and like us on our Area Agency on Aging's Facebook page. You will receive the most current and relevant COVID-19 information, upcoming events, and services that are available to you. And as always, I'm available by phone at 520-432-2528, extension 221, or by email at kenriquez@seago.org. Thank you so much for attending, and have a wonderful evening.